Irregular menstrual cycles and when to take action. Most women experience a normal menstrual cycle that lasts about 28 days. However, many women suffer from irregular cycles that deviate from the norm. Irregular cycles are cycles where periods occur less than 21 days or more than 35 days apart, include missing 3 or more periods consecutively, or involve unusually light or heavy bleeding. An irregular period can show up in many ways. One sign is when the number of days between each of your periods keeps changing instead of staying the same. For example, you may have 30 days between periods one month, but 45 days the next month. Another sign is when the amount of menstrual blood changes dramatically from one period to the next. You might have much lighter or heavier bleeding than what is normal for you. Also, periods that come very close together or very far apart can signal irregularity. If you get your period in less than 25 days from the start of your last period, that is considered irregular. Likewise, if you go longer than 35 days between period start dates, that is irregular. While some irregularities can be normal, especially for young girls first starting their cycles, consistent irregular periods can signify an underlying health condition. It is a good idea to track your cycles so you can identify patterns and discuss any concerns with your gynecologist. There are many reasons why you might not get your period regularly every month. The main cause is hormonal changes. Two key hormones, estrogen and progesterone, regulate your menstrual cycle. When these hormones fluctuate, it can disrupt your cycle. Other factors like stress, weight changes, eating disorders, intense exercise, and birth control can impact hormones too. Underlying health conditions can also lead to missed, heavy, or irregular periods. If you experience irregular cycles occasionally, it is usually not a major concern. However, you should make an appointment with your gynecologist or women's health doctor if the irregularities persist over time. See your doctor right away if you have pregnancy concerns related to unexpected bleeding or missed periods. Bleeding when you are typically not menstruating could indicate a complication. You should also see your doctor if you miss 3 to 6 monthly periods consecutively. Prolonged lack of menstruation sometimes signals an underlying health issue. Ongoing bleeding between expected periods is another reason to seek care. This could be a sign of uterine fibroids, polyps, or other conditions. Highly irregular cycle lengths over many months, such as alternating between very short and very long cycles, warrants medical attention. If you experience heavy, difficult to manage menstrual bleeding regularly, you may have anemia or another condition causing excessive blood loss. Once you are over 25 years old, you should have periodic pap smears and pelvic exams to screen for cervical cancer. Use this annual visit to discuss any menstrual concerns with your women's health provider as well. Don't hesitate to consult a gynecologist in Singapore if you have ongoing concerns about heavy, painful, or inconsistent menstrual bleeding. Stay positive and practice self-care as you navigate irregular cycles.